Hi there, Dr. Tony Madrill, back on the YouTube channel. In my last video, I talked about the difference between classic PTSD and complex PTSD. In this video, I would like to answer the following questions. One, what is the difference between top-down and bottom-up therapies for trauma? And two, why is this important to know as someone seeking trauma therapy? Bottom-up treatments such as EMDR work through the body and the reptilian part of the brain to have a positive effect upon the limbic system, or emotional brain as it's sometimes called. Bottom-up treatments can be helpful in situations wherein a person may not have explicit memories of their trauma, when they may not wish to directly share about their traumatic experiences with therapists, and many bottom-up treatments do not require either verbal or written disclosure of the trauma. And finally, bottom-up treatments may be indicated when a person is seeking therapy that may be helpful to resolve their trauma symptoms in a relatively short amount of time. On the other hand, we have top-down treatments such as cognitive processing therapy for trauma. And top-down treatments work through the thinking and reflecting part of the brain and can be helpful in situations wherein a person works well with thoughts and language and may already have some experience receiving the widely prescribed cognitive behavioral therapy. It's also indicated when a person might benefit from cultivating internal relationships between different parts of their mind, some of which may be holding on to traumatic material, which may be creating ongoing underlying distress for that person. Top-down therapies may also be recommended to help uncover beliefs that are blocking a person's recovery from the trauma. It is important to note that these two different types of therapies can ultimately be coordinated by the trauma therapist so that the person in time may be able to skillfully respond to and sometimes prevent chronic fight, flight, or freeze responses in the mind and body. If you would like to learn more about best practices for trauma treatments, feel free to ask me a question below or visit my website. Until next time.